Good afternoon and welcome to the Flint Community Webinar on Coronavirus, which is sponsored by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Prevention Research Center. Today, May 7th, is our 60th consecutive week coming to you with this webinar to provide information to you about a global pandemic with a local context. I'm so thankful today to be your moderator, Yvonne Lewis, and excited about this wonderful session that we're going to have today. Today, we are celebrating, this is Mental Health Month. May is Mental Health Awareness Month. And you can help by going hashtag Stop the Stigma. Many people are afraid or concerned or holding back about talking about mental health because of the stigma. We want you to know today we have some very important information to share with you about mental health, some things that are happening specifically in our community that you can utilize and provide and understand the resources that are being provided to you by right here in our community. This past 60 weeks, we've had a wonderful partnership. As you can see, for those of you that are in the webinar with us, participants, organizations from across the city, across the state. And I will tell you, we've even had our congressman here from the federal level. This community webinar is stood up by great community partners, and we appreciate all of them for continuing to partner with us to bring this quality information to you. Today's program, and we're going to move quickly because we've got so much to share with you, we're going to focus on the equity question, race, data, and COVID. We'll be talking more about mental health and what's beyond COVID, and what can you do during Mental Health Month that'll make a difference for you. And also, we want really to bring to you some information about treatments that are available as it relates to COVID. So much information to share with you. You see, our presenters today will be Dr. Deborah Verholden, Mary Catherine Crawford, Dr. Susan Wolford, Gary Jones, Dr. Lawrence Reynolds, Katie Baxter, Afton Shavers, and Sherelle Bell Brown. We look forward to sharing information with you. So we're going to ask you early on, put those questions in the queue. If you have questions, please put them in the queue so we can get them answered for you. In addition, you can give us a call. If you can't get in the queue, give us a call at 810-835-2130, and we'd be happy to get your questions answered today. We're going to begin today our roundtable. And we're going to ask our panelists if they would come forward and be a part of our roundtable. Your questions are really important to us. One of the questions that we had last week did center around race data and the whole equity question. We weren't able to get to that before the session ended, but our panelists are here today to bring a conversation to you to address this very issue. So I'm going to invite Dr. Deborah Verholden, Dr. Wolford, Afton, you were involved in this conversation last week as well, and also Sherelle Brown. Dr. Deborah, I want to just start off with you and have you jump in here because you're our epidemiologist, and you talk about the importance of the race data, especially if we're ever going to get to equity. You've helped us to understand without the proper data, we can't get there.
Yeah, data is everything. It's hard to identify the extent of the problem if you don't have good data to be able to do that. So a big area that I'm working on now, and I've been publishing in this area, is called health data disparities. And health data disparities have two main features of them. One is incomplete or insufficient data that we find in patient records and medical records for racial and ethnic minorities. Literally, I just published a paper called Even in Death, and we find that the quality of the death record is not even as good for African Americans as it is for other racial groups. So it's worse quality data, health data for racial and ethnic minorities. Then the second aspect of health data disparities is what I call unacceptable and mostly avoidable omission of race and other demographic data from vital health data that would be used to help us identify health disparities. And I think COVID is a great example, right? So we've actually, our first 2.5 million doses of vaccine that we administered in Michigan, we didn't have race for 44% of those people. And we didn't have ethnicity for 70% of those people. And it makes no sense because by contrast, we had zero missing data for the age category. So we We're able to collect age. We were able to input it into the data collection system that we use, which is called MICR. And we have clearly the ability to collect demographic data. We just weren't doing it for race. We had less than 0.1% of data missing gender, yet 44 and 70% of the data were missing race and ethnicity. It's unacceptable. And it begs the question, why? Couldn't the same programming that went in to make it so that you couldn't move forward without entering in age or without entering in gender, why wouldn't we make that same built-in, procedure for race data? And I've heard all kinds of excuses from people, and I want to be bold here and say they're excuses. People say things like, well, maybe people don't feel comfortable asking, or maybe if people don't feel comfortable providing that. Even worse, people say things like, we need training. We should be training people on how, and I'm just here to offer all of that is poppycock. It's poppycock. And the reason that you're on mute, Yvonne.
That's a controversial thing, Dr. Deborah. We had all this, don't put people's race down because that's discriminatory. And now you're saying it's necessary for us to do that?
Well, here's why I say it's poppycock. Because when I go to the doctor, they don't say what's your age and what's your gender and what's your race and what's your zip code. That's what we're trying to get. These basic demographic variables: age, race, ethnicity, gender, zip codes. We have some idea where people live. When I go to access a healthcare service, and the COVID vaccine is a health service, okay? My doctor wants to know my exact date of birth, not my age, my exact date of birth. They don't want my zip code. They want my exact address, my exact home and work address. We are all used to providing very detailed information to access healthcare services. If I refuse to provide that information to my doctor, they simply would not see me. They would say, okay, well, you're not willing to provide that. We then have no way to confirm with the insurance company that in fact it was you that presented for care, and they wouldn't see me. And we don't even need people to ask. You hand them the card, they give it back. You say, hey, you've missed the cell. You highlight the cell they missed in yellow, and you hand them back the card. Like it's unacceptable to me that we're making excuses. I feel like the unacceptable omission of race is one that we all just somehow have become okay with. When you say African Americans have been vaccinated at half the rates of whites, people go, really? But if I said women were being vaccinated at half the rates of men, people would be up in arms. There's just, to me, this dull sense around race and sort of an acceptance of, well, things are just going to be how they're sort of going to be. And I'm just here to say that's not the case, and it shouldn't be that way. It's unnecessary and it's unacceptable.
So, Dr. Deborah, I see some heads nodding. I see Dr. Jennifer and Dr. Susan, and I see Afton smiling. They want to jump in here on this conversation.
All right, let them
so come on. Afton, what are you're not a physician, but what do you think about this?
I'm absolutely not a physician. That's for certain. But when we were having this conversation last week, we were kind of talking about how, there might need to be some sort of investigation into like why it is that this isn't happening. So Sherelle had sort of shared a little bit about the process of how they're actually going through administering vaccines and like the protocol of how people are filling out those forms. And we were kind of discussing the idea that, maybe we need to have a few people, just go and see if they're treated any different, see if the questions that are being asked of them are any different. And I sort of suggested that's how we do housing discrimination testing. We send two folks that look different with the same script, the same story, same credit score, and then see whether or not there's a difference in how those folks are treated or the questions that they're being asked. And so, I'm certainly not going to create the field study, but there may be a need, at some point to sort of investigate a little bit deeper if that's why we're having these concerns. Because if there's a process or a protocol in place of how we are actually administering things, then we can't just stray from it because we don't want to ask that question or because we don't feel comfortable, with that expectation if that's a requirement.
Now, Cheryl, you're nodding because you're out at you're out at these events and you see what's being asked of the individuals who are getting these vaccines. Are they shying away from answering these questions if they're asked?
From my personal experience, when I've come across a registration form that does not have a box mark, I simply address it with the client and ask them what their race is. And they have no problem telling me with what it is. Most of the time, oh, I didn't see that box. I left my glasses in the car. Sometimes I might get a person to say, well, I'm white, you can't see that. But it's not for me to assume, but I'm also comfortable with asking. So I do ask if I see that that box is not checked, and normally it's not a thing where people are not wanting to report. They simply aren't filling the paperwork out completely incorrectly.
Let's get back to the docs and say in a hospital setting. How does this play out in a hospital setting? Especially as Dr. Deborah said, you're going to ask us these questions, and if we don't answer you.
I think we might have lost our host.
We lost our host.
So Dr. Wolford, it looks like you were primed to answer. Yeah, I think you got where she was going. What's this?
Yes, I think I got where she was going about this, about the data. So what I think is really interesting is that in hospital data, there are problems with race as well. So when we try to analyze outcomes, patient satisfaction, things of that nature by race, we find that the data there are also inadequate. And so I think it really is a wide-reaching problem. And maybe if people understood that there's such a difference with needing to know race in a medical setting versus needing to know race when you're buying a house. Yeah, if somebody asked me about my race when I was buying a house, I'm probably not going to tell you, because you're going to make me pay more and you're going to, devalue my house and all of those sorts of things. But if we're asking about race in a medical setting, it is because it's important to care, it's important to services, it's needed. We're not just asking it just because. And so I think when people get the sense that this is really important information, just as important as knowing what your gender is, just as important as knowing what your height and your weight is. No, I wouldn't tell anybody my weight. If somebody asked me my weight on it, no, I will not tell you. But I will tell my doctor, because it's important for the care. And yes, people can misuse those things, even in healthcare. People who have excess weight find that sometimes just because they have excess weight, every time you go into a doctor's office, that's all they want to talk about. But just because somebody might not use it the best way doesn't mean it's not important information. It's needed, and it's needed to be used appropriately to help give optimal care.
Okay, all right. Dr.
I think there was something
to that.
Well, I think there's something that you often will highlight that we need to think about as we move forward. And some of that is you have to bake the equity in. And I'm stealing something you always say, but we have to cultivate a culture in which we don't look over that someone has not filled out race, but that it's a part and an expectation of what we do. Oh, this is another piece of the form that we absolutely have to have filled out. And if we look retrospectively, or we ask after the fact if we thought race was, something that might have played a factor in poor care, what have you, we can find it, but we can also be thoughtful in the forefront about how we think about being equitable, right? So just like we're able to identify barriers early on and everything else, we can say, how can we be equitable in making sure we're distributing vaccines, for example? How do we make sure we're in the spaces where people who are from diverse backgrounds exist? How do we make sure that people who may not have internet access have access to, the phone or ways to sign up for the vaccine? We have to be thoughtful about the equity from the beginning.
Yeah. Yep. Mm-hmm. Okay, our host made it back. And she's being brilliant on mute.
And I'm saying technology, right? It just did its thing. But thank you for continuing that conversation. So where do we go from here? And I hope I didn't miss anything, but where do we go from here? Since we want to be sure that the data is accurate and what it needs to be, what do you recommend? What do you suggest to the individuals or to the providers that are saying, I'm not quite comfortable asking that question about race?
Well, I think, and Dr. EJ was talking about this, how we just got to get it baked in. And what a lot of people don't know is we actually have some laws that are just not being enforced. I love to tell the story of when my son wanted an Xbox in his room. And I said, well, your grades have been terrible, so you get straight A's, ha, ha, ha. and I'll get you the Xbox. I didn't get the kid a tutor. I didn't spend any more time with him. I just attached the resource that he wanted, that Xbox, to the outcome that I wanted, which was straight A's. And he got straight A's. It was like mind-blowing to me, you know? And so I think people want these resources. They want COVID tests. They want COVID vaccine. They want their share of the pie of this, you know, new round of reinvestment money. I think we need to tether to that. If you want that, you have to demonstrate and prove that you can and that you are getting these resources out to people fairly and equitably. And you can't do that without data. So I do think we actually need mandates for those data. And there need to be real incentives for people, which is the resource, to collect it. And there need to be disincentives for people to not collect it. There's no reason to have, and you'll see when we get to the equity brief, 40, 50, 60% of the race data missing for COVID cases. How can we with confidence say whether or not we've kept that disparities gap closed when more than half the data are missing race? It also undermines the power and the whole real strength of having electronic health records if so much of the data is going to be missing. That was the whole point, that we would have data that would improve care, quality of care, delivery, allow us to do research, allow us to understand levers to push and pull to make sure that people were being served, you know, fairly and equitably. And if we just do a shoddy job on the data, intentional or not, then we've undermined the whole point of all of these great innovations. So I think we need some laws around this and some policies with some enforcement and support for people, but supports that build solutions that match the actual problems, not the made up things that people are saying.
So thank you, Dr. Deb, and thank you to this panel. There's more information, and I see you put something in the queue in the chat there, Sherelle. Everybody has a responsibility. It's not all the client's fault. It's not all the provider's fault, but everybody needs to take some action. So we want to encourage you today. If you're in line or if you know somebody's in line, tell them how important this is and have them complete the documentation. But and if they're not asked, you know, it's okay for us to say, so why didn't you ask me that question? Because it's an important question to be asked. So thank you to the panel. We've got so much information we want to share with our listeners today. We're going to move into our next segment, but I'm going to ask you all, please continue to put those questions in the queue because they help us have a robust conversation and make sure we're answering the questions that you want to have the information for so you can make that informed decision. Gary, I understand you've got to kind of take a leave from us today early. So we want to get the insights and updates from the governor's office. So welcome, Gary.
Yeah, thank you. Yes, I'm sorry, I have to leave at 12:30 to pick up my daughter, but just a couple quick updates from the past week. So recently, the governor issued a proclamation marking May 6th through 12th as Nurses Week. We know nurses play a crucial role in our healthcare system, and they have selflessly served on the front lines of the COVID-19 pandemic for over a year. In times of crisis or calm, nurses consistently provide high quality, personalized care and support other healthcare workers routinely going above and beyond for their patients. The best way that we can say thank you to our nurses is by masking up, washing our hands, social distancing, and getting our vaccines as soon as possible. Both the governor and the lieutenant governor recently announced that Michigan has administered 7 million vaccines. To date, 50% of Michiganders have received at least one dose, with 38% of Michiganders being fully vaccinated, moving the state closer to its goal of equitably vaccinating at least 70% of Michiganders ages 16 and older as soon as possible. Last week, Governor Whitmer set the state of Michigan on a pathway to return to normal by unveiling the My Back to Normal plan, as the state continues to push towards its goal of vaccinating 70% of Michiganders ages 16 and older. To facilitate this goal, the Michigan Department of Health and Human Services will base future epidemic order actions on 4 vaccination-based milestones that, once achieved, will enable Michigan to take a step towards normalcy. So once 55% of Michiganders plus 2 weeks are vaccinated, it will allow in-person work for all sectors of business. 60% of Michiganders plus 2 weeks increases indoor capacity at sports stadiums, capacity at conference centers, banquet halls, funeral homes, exercise facilities, and gyms, and it will also lift the curfew on restaurants and bars. 65% of Michiganders plus 2 weeks. You're going to hear me continue to say plus 2 weeks because Dr. Reynolds made sure that I say the plus 2 weeks part. So 65% of Michiganders plus 2 weeks lifts all indoor percentage capacity limits, but will still require social distancing between parties. And once 70% of Michiganders plus 2 weeks lifts the gatherings and face mask order altogether, such that MDHHS will no longer employ broad mitigation measures unless an anticipated circumstance arise, such as the spread of a vaccine-resistant variant. Let's knock on wood, that is not the case. And lastly, Governor Whitmer and our Chief Medical Executive, Dr. Janae Calhoun, recently issued a statement after President Joe Biden announced a national goal to have 70% of Americans get at least one dose of the safe, effective COVID vaccine by July 4th. The announcement comes after the governor unveiled her My Vax to Normal plan to base additional re-engagement on vaccination rates, with the final step being 70% of eligible Michiganders receiving one dose of the COVID-19 vaccine plus 2 weeks. So lastly, I always like to end with plugging the catch-all websites, michigan.gov/COVID vaccine and michigan.gov/coronavirus are still the best catch-all websites to keep up with everything.
Thank you, Gary. That plus 2 weeks, get it in there. The vaccination is important, but we have to have that 2 weeks time in order to be sure that we've got the full immunity. And so this encouragement is very, very important. Thank you, Gary, for that updated information. As we said in the start of the webinar, May is Mental Health Awareness Month. And there has been for many, many years a stigma. People were hiding and not wanting to come forward and say, I've got a concern or I need some help. And so part of our goal here today is to kind of help reduce that and really to consider that under the stress of the water crisis, life itself, and now COVID, many of us have been overwhelmed at so many times. But we have some assistance here today. The Genesee Health System, Katie Baxter, is the Senior Director of Clinical Services, is going to share some information with us and also encourage mental wellness. Katie.
Hello, Yvonne. Thank you so much.
Good afternoon.
Thank you for having me. And it's so important today to talk about mental health. And so today I just want to take a few minutes to talk about a few things. One, why is it important? Why is mental health important? What are some basic facts about mental illness? Some of the impacts of COVID related to mental illness, what kind of supports and services we have available, and also to encourage you and those you care about to take care of your mental health. Yes, this month, May, is National Mental Health Awareness Month. So why is this important? Please keep in mind that there still remains a lot of stigma about mental illness. That think about for your own experiences, people you know and people you interact with. You may have a conversation with somebody that you don't know very well, and they may tell you they have diabetes or a heart condition or some other kind of medical condition. And they may tell you, talk about it just in casual conversation. But at the same time, how many people do you know are willing to talk openly about challenges they've had with their mental health? So there is a lot of stigma related to mental illness. And it's so important that we talk about it and we promote recovery and we promote things that can help people stay well and to get the help they need. Many people wait until it's too late to get the help they need. And we want to focus on people being open and willing to talk about their mental health struggles and to normalize that because it's just part of our health, our physical, mental, social, and spiritual health. Those are all aspects of our health. So it's important that we look at all areas of our health. I want to let you know, and some of you may have seen the statistic that 1 in 5 Americans will experience a mental illness in a given year. 1 in 5, that's 20% of the population. And 1 in 25 Americans live with a serious mental illness. What that means is illnesses such as schizophrenia, bipolar disorder, and major depression. keep in mind those are less common, but still think about it. In this webinar, sometimes we have 100 people on this webinar. So 1 in 25 would mean 4 people in this webinar have a serious mental illness, and 20 of them struggle with mental health challenges. So it is not uncommon, and it is part of being human. It's okay to talk about, and it's okay to get help. That's really important. These are some basic statistics and information about mental health and the impact of COVID-19 on individuals' mental health from our CDC from February of 2021. We are very concerned because we are seeing very high rates of increased anxiety and depression. And the data says 4-fold increase of anxiety and depression. That's extremely high. We're also seeing higher rates of suicide and thoughts of people considering suicide. Look at that. Number of people seriously considering suicide has doubled. We also are seeing an increase of use of alcohol and illicit substances. And even people who did not report problems with alcohol are reporting they're drinking more than they have in the past. So we're seeing increased use of substance abuse and overdose deaths. In the United States, overdose deaths have increased by 33% during pandemic times. It's extremely concerning, and it's a real problem. So it's very important that we draw attention to mental health, because every week we talk about all the things related to our physical health, our safety, and our physical health and maintaining that. But it's so important that we're aware that our mental health is very important, and we need to take care of our mental health as well. We have many supports and resources available at Genesee Health System, and I want to talk to you about a couple different things that I think can be useful. And one is our virtual behavioral health urgent care. I say virtual, this means you have to have some kind of a smartphone or a computer or an iPad or tablet or something. But it allows you to talk with a counselor, a behavioral health specialist, a master level clinician, related to challenges you're having. You do not need to have a serious mental illness to access the service. This is open for anyone in the community. If you are having troubles, problems, you're worried about things, please reach out. It is 24 hours a day, 7 days a week, 365 days of the year, and the number is 810-257-3740. Please keep that in mind. We have counselors available 24/7 to talk to you. And again, if it's not a serious mental illness, but you're just feeling stressed out, you've lost somebody, you've lost a job, you're caring for people, you're worried about taking care of your job and your children that you're educated at home, whatever your needs are and your worries, please call us. We want to help. Also, I want to talk about a really important service called Intensive Crisis Stabilization Team, or ICSS. This is for children in Genesee County from the ages of 0 to 21. And there are hours, it's 7 days a week, 8 a.m. to 7 p.m. But this is a really important service. It's on-site intervention, face-to-face, and two professionals can come out to where you are in the community and help you resolve the concern that you are having. This does not need to be a full-blown crisis. This is a prevention intervention. So if you are a parent or a guardian, a caretaker of youth, and you are just feeling challenged, your child's having problems, struggles, emotional issues, they're just having a really bad day and everyone's at their wit's end, please do not wait until it gets too bad. Please call us and we can assist. And this is a underutilized intervention, and you do not need to have Medicaid, and you do not need to have a serious emotional disturbance. Anyone can access this service, so please utilize this service. We have many other resources that are available to our community that I want to talk a little bit about. With our partnership through Recast, we have a lot of trainings available for the community. Please take advantage of these free trainings. Many of us have taken first aid and learned about how to help somebody if there's an emergency. If somebody's choking or somebody's had a heart attack, we want to know how to help if that happens to somebody we know or somebody we come upon. And mental health first aid is another training like that. It's first aid for mental health challenges. And you learn so much. It's a wonderful course. And everyone who takes this tells us that they've learned a lot and really appreciate it. We have psychological first aid to help people talk through and assist people who are struggling with issues in their lives. We also have a variety of suicide prevention modules from QPR, question, persuade, refer. And also Living Works is an evidence-based practice training that helps individuals know how to talk to somebody about suicide. We don't realize this is so important, and one suicide is too many. Suicide is growing in our community and across the nation, so we all have a responsibility to take part in learning about it and helping somebody. This could be someone you love, and sometimes it's a matter of just asking a question, just inquiring, helping somebody get the supports they need. So these are, even though we're not all mental health professionals, we don't need to be, but we can still make a difference. So these are really important resources and trainings, and we encourage you to reach out and find out more about these trainings. You can still call the same main number through our customer services department at Genesee Health System, and that's 810-257-3740. That's Monday through Friday, 8 to 5. Please reach out and get information on these trainings, and let us know what you think about them. We really appreciate that. Also, we have wonderful news. Many of you know our millage passed. So we are so excited about this because these are dollars that will go back into our community for mental health services. We are so excited and we are very pleased about this. We are mostly Medicaid funded at Genesee Health System. We are the community mental health agency for Genesee County, and we are funded mostly through Medicaid. So we do not have a lot of flexible funding to do the kinds of programs that we want to. Some of them we manage to do through grants and such, but these are limited and short-term funding sources. So this will allow us to sustain some of these wonderful efforts and to expand on some other areas. These are the 7 areas that we are working on. It includes our crisis intervention team, which allows law enforcement workers to have access to behavioral health treatment specialists so that when they come across somebody with a mental health challenge, they don't have to bring them to jail or to the emergency room. Sometimes it's diversion efforts like this that can prevent a crisis. It's so important, and we want to sustain that. Other things are related to law enforcement and jail diversion, courts and corrections, suicide and crisis prevention, to continue a lot of these worthwhile programs and trainings and supports. Also work in the schools. Prevention is so important. We believe in prevention and wellness and recovery, and we want to expand that and do more work with the schools. Also, our crisis center, we have our behavioral health urgent care, but it is virtual, and we want to have a brick and mortar, one place for individuals to go when they're in crisis, rather than having to go to the emergency department when they're having a mental health crisis. So we're very excited about that. And it'll also mean health and wellness dollars for vulnerable populations, a variety of resources and supports in the community that we don't currently have funding for. So we're very happy about that. That's wonderful news. And lastly, I just want to remind everyone that our mental health matters. Our physical, mental, social, and spiritual well-being is all part of our health. And so just as we're thinking about protecting our safety and our physical health, please take care of your mental health. And if you need help, reach out and ask for help, because we are here to help you. Thank you so much, Yvonne.
Thank you so much, Katie. And there's a lot more information, and there are some questions in the queue that we're going to try to get to. We know that nutrition, one of the questions, plays an important role in this. And so, Katie, if you can answer that question in the queue, are there nutrition opportunities, education opportunities involved in these mental health programs? And I just need a really quick answer to that, and then we're going to move forward.
Yes, that's a great question. And that's one of the things we're looking at. Right now, we're in the process of this funding will not come through until next year. So we're in the process of developing programming, and nutrition is one of the things that we consider in health and wellness and how we can support people, because we do have a lot of challenges in the community related to health and nutrition. So yes, we are looking at that area as well.
Thank you, Katie. Thank you so much. And in addition to what you're providing directly at GHS, Afton Shavers is here to give us some more insights on the wonderful programs that are happening through Recast. And we want to just get the updates. Afton, what's happening every day in the month of May?
Hey, Yvonne. So we sort of gave you a preview last week when we first kicked off our mental health awareness month. And so you can go to the next slide, please. So we just wanted to give you a quick overview again of what we're doing. So once again, like Katie said, we're really trying to raise awareness around stigma, reduce stigma. And for the Recast team, we're working on things that are impacting our trauma and our stress levels. We realize that that's physical, emotional, and mental well-being. And so we wanted to create some opportunities that we thought would really get some information to community in some different ways, some more exciting ways, that would kind of make people feel more comfortable, if you will, in talking about mental health. So like I said, we previewed this last week for you. And so we kind of talked about, we have a weekly calendar of events. So this is the week 2 calendar that you're seeing in front of you. This is what will be happening for next week. We do have things planned every single day. So last week we kind of kicked it off. We had an overview video that our GHS team did for us that was really spectacular. We did our very first Talk About It Tuesday, which was really well received. We had over 500 views so far on our Talk About It Tuesday. And so that's an interview style sort of short question format with our team and with the professionals from Genesee Health System. And so this past Tuesday, we talked about anxiety and depression. And if you did not catch that, you can still catch it on our Recast Facebook page. Is still loaded, so you can still take a look at that. And then Yvonne wanted to know about our our healthy donuts. So there's a cute video that was made by our Commit to Fit team that's also on our Facebook, so you can watch that. And there is a recipe that goes with those healthy donuts as well. And we also just got that translated into Spanish. So we have it in English and in Spanish for anybody who wants to participate in making some healthy donuts. Next slide, please. We want to sort of share with you the fun stuff, right? So we know that we have to do some things that are interesting and entertaining to get people involved. So we have some funny games planned. We're going to do Mental Health Jeopardy. This will be hosted live on Facebook. And so people will be able to attend, ask questions. Hopefully we'll get a winner. And we have a little something for our Mental Health Jeopardy winner. We're going to do a Mindful Jars youth activity with kids at the Boys and Girls Club. And so this is an activity where we sort of create, it looks like a snow globe almost, but we create these mindful jars. We use color and paint and glue. And so really it's an opportunity to kind of talk with kids about emotions and sort of processing their emotions and balancing their behaviors and responses. So it's a really cool, fun activity, evidence-based, but still fun. And then we're going to do a Grow Positive Thoughts activity with the seniors over at Hasselbring Senior Center. I'm a firm believer, we got to get everybody involved. So we got something for kids, we got something for seniors, we got something for everybody in between. So our Grow Positive Thoughts activity will be planting some seeds, literal seeds, and also some seeds of positivity. Should be a really fun activity, especially if the weather turns out good and we can do it outdoors. We do have a rain plan just in case, because this is Michigan, but we're hoping to be able to get outdoors and have some fun with our seniors. We're going to be hosting the movie Inside Out at the US 23 Drive-In. Unfortunately, we do have to limit capacity for the drive-in to 75 cars. It's all they will allow us to do for this, but it is free. 75 cars are able to come and hang out with us and watch the movie. So if you've never seen Inside Out before, it really shows children about like how to manage their emotions, and really about like thinking about their feelings as a term of mental health. It's a really great production. So I hope that you get a chance to hang out with us. We also have some yoga, some meditation that the Crim Fitness team is doing in conjunction with our Mental Health Month as well. Next slide. As Katie mentioned, we have some training opportunities. So the psychological first aid, the QPR, question, persuade, refer, mental health 101, and also mental health first aid are available throughout this month. You can sign up for those by going to GHS's website, click the big recast logo on the right-hand side, or you can search for them. We have some activity sheets. We actually just uploaded these, so they are available right now. If you go to flintrecast.org, you can download these. We also have some worksheets and fact sheets that are available in Spanish. Those are uploaded as well onto our website right now, so you can download those. We are including Spanish translation and closed captioning on our videos as well, so that we are making sure that we can be as accessible as possible for folks. We also have some coloring sheets that are available. These are loaded right now on our website as well, so you can download those. And so we know that, once again, evidence-based, but also fun, that coloring is a way to stimulate your mind and also calm and soothe yourself. So we know that kids like to color, but adults, you can color too. And we want you to take advantage of this opportunity. So all month long, we got a whole bunch of stuff going on. If you can see the picture to the right, there's the list of everything. We got at least one thing every day. We've got some TED Talks. We've got some self-love language activities. We've got some journal prompts that will be coming up. And we'll be doing a couple more things, like I said, live and on our Facebook. So check us out. You can visit us at flintrecast.org. Check out our Facebook or our Twitter. We have some things on our Twitter feed as well. And if you have questions, issues, comments, concerns, you can send us an email at recast@flint.org.
Woo, Afton, thank you so much. Now we got to get all of that straightened around in our minds, but we want you to know that you can pick and choose those areas that are interesting to you and that will fit into your schedule. There is something for everybody. So thank you, Afton, for all the work that you're doing and have done to put this together. Now, as we continue to think about our mental health, we also want to make sure we're focusing on our physical health. And Dr. Susan Wolford is going to come and give us some more information about treatments during COVID. Again, we've got a lot of information, so please stay tuned. Dr. Wolford.
Thank you so much, Yvonne. So we have talked about the three things that we know help with COVID treatment, right? So we talked about the monoclonal antibodies that we can give early on. We talked about the antiviral medications that stop that virus from making copies of itself. And we talked about steroids because we mentioned that the immune system in the beginning, we want it to really work well and help us fight off COVID-19, but that in the course of it, many people who have very severe cases of COVID-19, as they move through that course later on, the immune system is doing too much and is actually damaging us rather than helping. And in that situation, steroids can help. So now we're thinking about, well, what else? And so we don't know of anything else really that definitely works, but there are lots of things that are being considered. And as we think about that, I'd like to just bring our minds to think about how we decide whether something works or not, right? So if we imagine, let us, and this is part one because we'll have to do it more than one day. If we imagine, think about Zoom use. Say we did a study and we asked people about their Zoom use, and we also asked them about their weight. And we realized that people who have increasing uses of Zoom have an increase in their weight. It would be true. We might assume then that, wow, Zoom use causes weight gain. And so we would have a breaking news to share with the world. Alert, Zoom use causes weight gain. All right, but really does it? I mean, if we changed from Zoom to Blue Jeans or Teams, would we lose weight? Probably not, because people who use Zoom are sitting in chairs a lot, drinking coffee because we can get to it, eating from the refrigerator because it's nearby, and stressed out because we're in meetings all day. All of those things are associated with Zoom. The same things are associated with excess weight. And so what we have here is an association, but they're not actually causing, Zoom is not causing weight gain, but they're associated with the same things. And we've probably not captured enough data to find out how long people are sitting, find out how stressed they are, and then we would be able to find the things that are really related. And that's a plug for one of the reasons why we should actually collect race, because it could be important. We just need all the right data. Limited data gets us erroneous results. Anyway, or not complete results. So similarly now, as we think about vitamin D, there are a lot of studies at the moment which are suggesting that there is an association. They are finding that people who have low vitamin D levels had poorer outcomes with COVID-19. The question is it because of vitamin D specifically, or is it that vitamin D is associated with other things in our lives that are also associated with having how well we do with COVID or not? And so we're going to look at some of those things as we move forward over the next couple of weeks. But one of the things I want to mention about vitamin D, when we think about vitamin D and why it might actually play a role, and it might be more than just an association, is most of us think about vitamin D, we think that it's related to bone health and calcium, and it is. But it's also related to our immune system. And so when you think, last time I was telling you, when you think about monoclonal antibodies, think about clones, as they're making many, many different copies of it, and then putting that into our bodies to help us fight the infection. When we think about vitamin D, I want you to think about a choir and the conductor of the choir. Vitamin D does a lot in our body, and it acts like a conductor when it comes to our immune system, making sure that all the parts are working well. It will elevate one side and then decrease the other side. It does that control really well so that no one part is doing too much. You're not just hearing sopranos, but you're hearing it all in harmony. That's what vitamin D does for our immune system. And so it's reasonable to think that in COVID-19, where these two things can be out of control a little bit, that vitamin D will help us. But we'll have to watch this space, because I'll tell you more about that when we revisit this topic next week. You're on mute, Yvonne. Yvonne, you're on mute.
Thank you, Dr. Woolford, because this is an ongoing conversation. As you said, we're learning more and more every day. So we want our listeners to stay tuned, put those questions in so we can be ready to answer them for you. Now, as we move forward, we know that if we're going to really tackle this COVID, we've got to do some testing, and the vaccines are available. So Sherelle, please tell us where we are as it relates to the vaccines here in Flint, Genesee County.
Good afternoon. I will tell you where we are today. So in Genesee County, we've administered about 244,000, a little over, vaccines to our community, with the Genesee County Health Department administering about 72,000 doses of those. We know now that 43.6% of Genesee County residents ages 16 and older have received at least their first dose of the COVID-19 vaccine. And I believe Gary mentioned earlier today that statewide, we're about at 50.9% of residents who have received their first vaccine. So we are making progress. That's good note for our mental health. So right now at the health department, clinics are walk-in, so there's no need to schedule for an appointment. We have walk-ins Mondays, Tuesdays, and Saturdays at Flint Northwestern High School. Just check with the health department to make sure if there's a cancellation. This Monday we did cancel Flint Northwestern Monday, but we had it Tuesday and Saturday. So I just want to put that out there to call and make sure that it's still going on. And you go back to the other slide, please. On that list, you'll see our other locations and dates that will be available for walk-ins. I do want to mention that in Genesee County, currently, we have seen all of the variants of the COVID-19 virus. Right now, we have about 102 cases of the UK strain, as well as 1 of the South African and 10 of the Brazilian, and a combination of the Californian strain. There's 3 cases total. So we want you to remember that it's still important to get those vaccinations. It's still important to get tested, because we do have variants, and those variants do spread much more easier than the original strain of COVID-19. So get your testing. Our testing locations have not changed. On the screen, you'll see that you can get tested at Word of Life Church, Bethel United Methodist Church, Macedonia Baptist Church, as well as your local Walgreens and Rite Aid and Hamilton Community Health Network. So after today, tomorrow, Saturday, we will hold a clinic at Northwestern High School where you can come and get your second dose of Pfizer and Moderna. This is a drive-through clinic, and you do not have to be a recipient of your first dose from the Genesee County Health Department. So if you missed your second dose and you got it at Meyer, come on out. We'll be able to accommodate you with your second dose on tomorrow. So from 9 a.m. to 2 p.m., we are accepting walk-ins. We have a few appointments, but just get there. We'll be there until 4 o'clock serving the public as far as giving out those vaccines. And like I previously mentioned, we are no longer doing pre-registration. You can schedule your own appointment today by visiting our website at gchd.us and gc4me.com. There you'll just choose which clinic you like to attend, and you'll be informed of which vaccine will be given at that clinic. Be mindful that if you have children who are 16 and older, they must receive Pfizer. So you want to make sure that you choose the clinic that will be offering Pfizer on the day that you want to go. And if you know anyone who is unable to access the website or internet, please have them still call us so that we can assist them with getting them an appointment to get their vaccine. Our phone number is 810-344-4800. And you can also use that number to get your loved ones who are homebound put on a list so that we can come out to their home and give them a vaccine. Currently, right now, the Johnson & Johnson vaccine is what we have available to our homebound citizens. With time and more resources and staffing, we'll be able to have other vaccines available as well.
Thank you so much, Sherelle, for that information. And of course, vaccines are currently available, and we do encourage you to continue to get tested. Appreciate all that information. We started at the top of the hour talking about the importance of data and equity. Dr. Deborah Verholden, the advocate for mandating equity, is going to now talk to us a little bit about what's going on with the updates and the policy brief and where do we go from here. Dr. Deborah, welcome.
Great, thanks, Yvonne. I'm going to just roll through this pretty quickly. So here we are in a good position in Flint. Second, third week in a row that our cases have started to drop. Remember back early in February, we were at 2.9%. And sorry, somebody keeps nudging me. We were at 2.9%, and then our rates started to skyrocket. So this is the second week in a row where our rates have gone down. I actually think it's the third week in Flint. And we had a 41% reduction this week. Our current testing positivity rate is 15.3%. What that means is of the people who get tested, about 15% of them test positive. That had maxed out at just under 21%. Next slide, please. The thing that we were talking about earlier is this problem that we have about missing race data. And one of the things that you'll notice is a little bit, some of these numbers are going down because what happens is each week as the data comes in, a little bit of the data gets backfilled on some of that. but you can see that we very much still have a problem with the missing race data. But outside of the testing positivity rate, would you go back, please? Outside of the testing positivity rate, what you can see is a good substantial reduction. So if you look on the left for Genesee County, last week we had between looks like about 1,300 cases. And you can see this week we're just over 1,700 cases. So that is like a major victory. The cases, like I said, reduced 41%. That's almost cutting the cases in half. So even though that positivity rate didn't go down as much, it is good news that the total number of cases, both in the county and in the city, both went down. Next slide. We love to show this because a lot of people sort of believe the hype that Flint was doing so bad. And remember, of all the municipalities in Genesee County, Flint is one of the largest. So if you're just counting up raw numbers, you've stacked the deck against us because we have more people. But if you look at the rate, and the rate is how many cases we have relative to how many people live in the community, Flint is actually ranked 21 out of all the jurisdictions. You can see us a little further down the line there, highlighted in red. And that means we're actually getting better. We were ranked 9th in March, and now at present, we are ranked 21st out of all the 28 municipalities. So let's keep up the good work, guys. This is, all of it could be cause to celebrate, but it's not cause to take our foot off the gas from doing what we know to do. I'm gonna stop there and hand it over to Mary Catherine, who's gonna talk about some of the policy implications.
Okay, great. Thanks, Doc. So first I want to start by addressing that incarcerated individuals are really sitting ducks for COVID infection. We're talking about unsanitary, indoor, overcrowded environments where there's poor ventilation, and detained individuals are also frequently lacking healthcare, nutritious food options, and protective resources. So these conditions and forms of deprivation create ideal conditions for spread. And this is really to allow people to be in this situation is really a blatant disregard of the 8th Amendment, in addition to other international human rights treaties that extend the right to health to everyone, including incarcerated individuals. So our legislators can take swift and comprehensive action to protect these individuals from COVID, including depopulating overcrowded prisons and jails, ensuring that PPE is available, and by eliminating copays that deter access to care. As Katie said, diverting individuals from being taken into custody are also another option. Preparing for future health emergencies. The influx of federal aid and funding that we're receiving right now presents a lot of great opportunity for state governments to establish new programs or replenish existing programs, including the Pure Michigan Business Connect, which is a great tool for businesses who need more PPE. And so one way the state can take action is to not only supplement this program's current resources, but also prepare for potential and future public health emergencies by taking inventory of that PPP which has gone unused and develop a need-based distribution plan. And I just want to point out that other states, including New Jersey, have done this successfully. And super quick, last but not least, mandate equity. Health equity means health equity extends to behavioral health. One policy initiative that significantly could improve behavioral health outcomes is if legislators were to take action and eliminate cost sharing to improve access to behavioral health services and also substance abuse services as well. We know that improved access to care reduces the overall cost of health, leading to improved adherence to treatments and reduced, emergency visits and other costly forms of healthcare treatment. So let's go on to how the community can help out with the COVID response. Keep doing what you've been doing. Call 1-888-535-6136 if you see businesses and workplaces violating health and safety measures. Keep using the apps that we know are helpful and tell us what our risks for COVID are, and be a good neighbor. Help people get to their appointments, give them a ride, share good links and phone numbers.
Thank you, thank you, thank you, thank you so much, Mary Catherine and Dr. Deborah for holding. And here we are at the end of our hour. We thank you all for joining us. And we want to remind you that for those of you who are community health workers, please continue to apply for those community health continuing education units. Also, for our social workers, at the end of the webinar today, please complete your evaluation so that you can receive your certificate for participating in the webinar. Appreciation to Michigan State University for being a good partner here with us. And as we always say at the end of the webinar, like us on Facebook, your sharing this information with others in the community is so critically important for us. We also want to encourage you to subscribe to our YouTube channel at Healthy Flint. Email us for any questions that you might have at info@hfrcc.org. And of course, feel free to call us at any time at 810-835-2130. We will be right here next week to see you, answering more questions, bringing you more credible information from the credible and trusted representatives who are here in our community. And remember, as we share with you always, your voice is important. We need to hear it. Let's make a difference for our community. Thank you for joining us, and we'll see you again next week.